wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. We're going to talk about a very unsuspected problem, not only in adults, but in youth and in children, and that is hypothyroidism, low thyroid. Now, the thyroid gland is located in your neck. It's shaped like a monarch butterfly, and it produces hormones that govern your body's metabolism, your metabolic rate, your energy production in your body. The hormones are T4, that's thyroid hormone with 4 iodine atoms, and T3, thyroid hormone with 3 iodine atoms. The T3 is the active thyroid hormone, but only a small amount, maybe 6%, is produced by the gland. 94% is in the inactive thyroid hormone, which circulates in the blood, then enters the cells, and in the cells there's an enzyme called deiodinase, which takes away one of the iodine atoms, and that's the active hormone. And then it is like, think of it like a spark plug in an engine. It catalyzes the energy production within the mitochondria, which is your power plant in your cell, which produces electrical energy, and you've got to have that energy to drive all the biochemical reactions within the cells of your whole body. The top of your head, in your brain, your eyes, your heart, your lungs, your liver, your kidneys, your bowels, all your skin, all the way down to the bottom of your feet. Thyroid hormone is critical and essential for good health. And when individuals don't get enough thyroid hormone within the cells, it's not the quantity that you have in your blood, it's the amount of active thyroid hormone that enters your cells. And there are certain things that prevent it from getting into the cells, like fluoride in the water. That poisons the enzyme in the cell that deiodinases or takes away one of the iodine atoms off the thyroid hormone. So if you don't deiodinase that, then you're operating off T4, which is very inactive, and it isn't the active hormone. So your voltage level goes down. You're low voltage. You're not making enough electricity. And so your metabolic rate goes down, and that affects the way you think. That affects your moods, anxiety, depression. It affects your dopamine and serotonin levels in your brain, which are your neurotransmitters. It adversely affects your heart. So people with low thyroid tend to have more heart disease. It adversely affects your immune system. If you don't have good metabolism, then your immune system isn't going to be able to fight off infections and parasites and various things that are attacked in the body. It governs all the organs, your adrenal glands and your sex organs in males and females all have to have good metabolic rate to function properly. So I wanted to talk about thyroid in kids. We see a lot of adults that we treat for low thyroid situation, and we base our treatment primarily on symptoms and not on blood work. We look at blood work, but blood work will not tell you how you're doing. Your symptoms tell you how you're doing. So if you're not thinking clearly, if you have cold hands and cold feet, if you tend to be fatigued and low energy and feel lazy and you never feel rested and you're tired all the time, if you got sluggish bowel function, if you got dry, scaly skin, if you get puffy, if you have difficulty with weight, these can be some common features of low thyroid situations that go unrecognized by most physicians because they want to base their thyroid diagnosis on a blood test. And let me tell you about the blood test. When you test thyroid in the blood, the way it's evaluated is by looking at the last 1,000 or 10,000 blood tests by the lab. And they get an average. What's the average? And that's called the mean. And then they apply 2 standard deviations, which is a statistical term of how wide the normal range is. So the normal range incorporates, when you have 2 standard deviations for the mean or the average, that incorporates 95% of the people's blood tests will fall within this wide range of normal. It's as wide as the Grand Canyon, as tall as the Empire State Building. So if thyroid governs your metabolism, and when you're young, you had good levels of thyroid, but the thyroid level drops by 50%, your energy level is going to drop by 50%. You're not going to function as well. You're not going to feel as well. You're going to be fatigued. You're going to have brain fog. You're just not going to be motivated or animated. And as people age, invariably their levels, their hormones, which work in concert, I'm talking about the sex hormones, the adrenal hormones, and your thyroid hormone, they all work in concert and communicate with one another. And if those levels get out of balance in males or females, by the way, testosterone enables your cells to convert the inactive thyroid hormone T4 to T3. So males, as they get older, they're not making a conversion, and they get andropause. They're still making some testosterone, but not enough to be fully active and feel vigorous and vital. And the goal is, as you age, is to have energy, vitality, and enthusiasm for life. And if your hormone levels go south, which they inevitably do in males and females, your vitality and your energy levels are going to decline. That's just the aging process. So you want to live a long time, but while you're living, you want to be healthy. You want to have a good health span. You don't want to just live and be decrepit and old and have one foot in the grape and the other on a banana peel. You want to feel healthy. You want to be active to enjoy your children, your grandchildren, maybe even your great-grandchildren, and still be active in life, bright and alert. And you know some people like that you know that are older, that are still sharp as a tack. But most people, you know, as they age, they tend to decline. They tend to get illnesses. They get sick, and they're just not active anymore. So this is why thyroid's so important. Now let's talk about thyroid in kids. A lot of children have problems, and I'm talking about children. These can be young kids. We've seen it in 2 and 3 year olds, but normally you're thinking in the teenage years, oftentimes, or in just before the teenage years, kids can be diagnosed with ADHD. Acute, they get very active and overactive, and you can't control them, or they become lazy, or they don't do well in school, they don't succeed. Maybe they don't grow like you thought they would grow, or when they get into their young teenage years, their puberty is delayed. Sometimes in girls, it can be premature puberty, but normally it's delayed, and then the young girls get dysfunctional uterine bleeding, and they have problems with the menstrual periods. They end up going to see some doc who throws them on birth control pills, which adversely affect thyroid function by causing estrogen dominance and the production of thyroid binding globulin, and so they don't do well. So if your child has been diagnosed with ADHD or been diagnosed as being lazy or having behavioral problems, or maybe anxiety or depression, maybe they're not thriving like you expect them, they're not growing like you would expect them to grow, instead of putting them on antidepressants and psychotropic drugs and ADHD medication like Adderall and some of these other things, you ought to be evaluated by a physician like we have here at the Hotze Health and Wellness Center that will look at the whole person and won't be prescribing drugs. Nobody has problems with fatigue, ADHD, brain fog, constipation, joint and muscle aches and pains because they have low levels of antidepressants in their body or low levels of amphetamines like Adderall. That wasn't normal. You didn't have those to begin with, and that's not part of your body's natural production. You want to have in your body what God put in your body to begin with, and that's your natural hormones. So even in young children, we'll prescribe based upon their clinical symptoms rather than having them on psychotropic drugs, antidepressants, Adderall. We'll give them low doses of thyroid based upon their clinical symptoms. We'll look at the blood tests and follow the blood tests and always keep it within normal range, but by adding a little bit of natural desiccated thyroid from a compounding pharmacy, we give that to the kids, and guess what? All of a sudden their metabolism goes up. All of a sudden they start growing, or their menstrual cycles become regulated. Or if they're males and they haven't really developed, all of a sudden they start to develop. They think better. They do well in school. They have more social activity. They're happier, healthier, and they enjoy life more, and they're more enjoyable to be around. So what I want you to consider is if you have a child who's suffering some of these symptoms, my recommendation is not to see a conventional doctor who's going to throw them on a bunch of drugs. Come and have them evaluated by one of our physicians here at the Hotze Health and Wellness Center, and let's see if their problems may not be hormonal, specifically if it may not be possibly to be a low thyroid disorder. Remember, all these kids are exposed to all these vaccines that have tons of chemicals in them. Now they give, I don't think, 72 or 82 vaccines to kids before they're 18, and they're loaded with all kinds of harmful chemicals that cause a host of health problems. The autism rate has gone through the roof from 1 in 10,000 now back in the 60s to 1 in 30, and this is a big problem, which I am convinced is related to the overload of vaccines that these kids get. God gave you an immune system to fight off infections, and there's no sense in loading your body up with a bunch of chemicals. Besides that, the foods that we eat are loaded with petrochemical products and all kinds of chemicals which adversely affect your hormones, including your thyroid hormone. So you want to clean up your eating program. First and foremost, I always say the most important thing you can do is eat healthy. Eat healthy food, vegetables, salads, and your meats. Cut out all this processed food. Doesn't mean you're never going to have a piece of cake or something. There's always going to be an excuse for a birthday or something like that. But, you don't want to be eating ice cream every night and have cakes and donuts and all that after church on Sunday and every other morning of the week. Eat yourself some healthy eggs. If you're going to have breakfast, have an egg for breakfast, or 2 or 3. As a matter of fact, it's going to sound strange. I'll tell you a little story. I have a dog, and my dog is a Labrador Retriever, and I give him raw eggs. And the lady that takes care of our home is from Guatemala, and she said, if those dogs, they start eating eggs, they like those eggs, you got to be careful because they'll get in the chicken coop and they'll eat all the eggs. And they eat them raw. And she said, my granddaddy was 105 years old when he died. He never saw a doctor, and he ate 2 raw eggs every day, as long as I can remember. I put that in my pipe and I smoked it. And I said, that's interesting. I go out to dinner the next night and I meet with a gentleman. We have dinner with a couple, and they brought another couple with them. And he had been a president of a high-level oil company here in Houston. He was 78 at the time when we met. And I told him the story about my dog eating eggs and about my our home caregiver giving her grandfather eating eggs. He said, well, you know what? My granddaddy lived to be 105 on the farm, and he ate 2 raw eggs every day, and so do I. So I thought, you know what? If it's good for the goose, it's good for the gander. So I take every day. I have here at my office, I have one of our kitchen caregivers comes in and gives me 2 raw eggs and a tablespoon of cod liver oil. And that's so very important for your health because it's ketogenic, and the cod liver oil is very important for brain function. So that's just a little tip, and that's a little personal story I'll give you. And that's what I said. If it's good for the goose, it's good for the gander. And I'm feeling pretty good for a gentleman my age. I tell you that. So anyway, if you've got a child who's struggling, don't take them to a psychiatrist. Don't let somebody diagnose them with depression or anxiety and put them on anxiety medication or these antidepressants and all that, which can make things worse and cause a host of health problems, or the Adderall, which is a gateway to cocaine. Come in and have evaluated and see if they wouldn't give them a therapeutic trial of thyroid. That's natural. And see if that doesn't help resolve their problems. I'm Dr. Steve Hotze. Thank you for joining us today. You can give us a call here at the Hotze Health and Wellness Center. We'll be glad to serve you. Thanks so much.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.